on the day of the egg collection, what we usually would do is bring patient in. We discuss the consent form, discuss the procedure that we'll be doing, and then maybe touch a little bit about the small risks that can be involved with the egg collection as well. But overall, what we're doing is egg collections are usually done under sedation. So most people really do not remember anything that happened at the time of the egg collection. The procedure itself is quite quick, takes about maybe 15 to 20 minutes. We go over the consent, discuss it then with the lab and the plan that we are planning to make in place, whether it's IVF or ICSI, whether additional treatments are needed, such as maybe assisted hatching. But eventually, once we've given the medication, you're sedated, you don't tend to remember what happened during the egg collection. The procedure then involves using a needle to go through the wall of the vagina into the ovary, and then we drain the follicles one at a time, and then biologists then start looking and checking for eggs. Once we have confirmation that we have an egg, usually we may need partner then to produce sperm, but overall the procedure itself takes 15 to 20 minutes, and it's just draining one follicle at a time and finding how many eggs we get altogether. So generally with embryo transfer, it's actually one of the quickest procedures that we have done in our clinic. So again, coming in on that day, they're mostly done in the afternoon, and you will most likely be awake for the procedure. And then what will happen is that we do a check, make sure the details correlate with the embryos that we're going to be putting back with the lab, and generally not much different from having a smear test done. A speculum goes in, and then we usually use a small fine catheter to put an embryo back, and usually the procedure is done within 10 to 15 minutes.